So today we've got a little kitty cat called Knox, and Knox had a really nasty cat bite abscess. Cat bite abscesses are extremely common in veterinary practice because cats are territorial and they love to fight. And here in Dubai, because people are moving and changing and moving apartments and nobody stays in one place for long, cats are constantly uprooted, constantly on the move, and so they're constantly redefining their territory, so they're always fighting. So Knox got bitten around the base of the tail, which is a very common place to be bitten. It's usually as a cat's retreating, another cat will grab it by its tail base. And his got very infected, and if you just come and look a bit closer, it's a little bit gruesome, so beware. He actually, now this wound is actually almost 3 weeks old already. It was really much worse initially. We had bite wounds around the tail and he lost huge sections of his skin, which we've been carefully treating. He had a big hole that went all the way up into here, and it was also deep on this side, and we packed these areas with Manuka honey soaked swabs, and we we basically packed the areas, and we had stay sutures around the side where we actually sutured the swab on. And he's been a very good patient. He's been leaving the tail alone, and he's been eating his food and being a good boy, and now this tissue is granulated and it's all pink and healthy. There's no infection present. And what we're going to try and do today is we're going to try and suture all of this tissue together in order for Knox to actually make a full recovery. We're even going to suture his tail to the side of his skin here to stop him from swishing it around, in order for the skin and the tissue to heal, in order for him to pass feces here through his anus without the tail getting in the way. And then when this is all healed and firmed up and we're happy, we'll release these sutures so that he can have his tail again. Because the other alternative we had was to actually remove the tail itself and try and close the wound that way. But Knox is a fan of his tail, so we thought we'd try and keep it on him. So we'll take another look at the end of the surgery. Okay, so this is our kitty cat Knox again. This is 3 days post-operatively. In the previous video, you saw his rather large, massive wound that was the result of a really horrible cat bite abscess. It was a wound that we managed by open wound management initially. So we just dressed it with Manuka honey and allowed the dead tissue to come away, and allowed a nice pink, healthy granulation bed, which you saw in the previous video. So this is 3 days after the surgery, okay? And you can see that Dr. Marek, our surgeon, closed the deficits and he's actually sutured the tail to the side of the skin, and in so doing pulled it over, so that this is actually the cat's little anus here, and this is where he's defecating from. But it was a really big hole, if you remember, and so we had to place a Penrose drain, which is what this is, that extends from here all the way to there, and it's allowing drainage of fluid, and we're going to be taking out that drain today because it's been 3 days since the surgery. In about not 10 days time, in about a week's time, we're going to release the tail from the skin, and then it should go back over the anus here. It might still stick out a little bit to the side, we're not sure, but we don't actually think Knox is going to mind too much, because in fact it'll probably make it easier for him to clean his bum after he's gone to the toilet. But the good news is that he's kept his tail, he can use his tail, and everything is closed up nicely, and it looks like it's healing well. And we're actually very pleased with this odd looking result, but we think it's quite a successful result.
Hi guys, we have here Knox 12 days from the surgery, where we suture the skin and the tail together. We still have a little defect here under, which need to heal on his own now, but now I am going to remove all the stitches, and this need to heal on his own. So